A medical home is a local, community-based primary care clinic or office or provision of care.
It's patient-centered. I mean, the most important thing is the patient being in the middle.
A place where you have medical professionals who you trust.
A patient is known, a patient is remembered, a patient feels safe, a patient feels comfortable.
Full service, in one envelope, quality care, addressing what they want and also what they need.
They care. They go out of their way to help somebody, just like a family would.
The New Hampshire pilot was a group of stakeholders coming together saying medical home looks like an excellent idea. We selected so many practices who could do well in terms of developing and providing core behaviors and functions of a medical home.
So what we're hoping for with the medical home is if we can help give some money out into the community to develop these medical homes, then they're delivering a system that almost guarantees outcomes.
Financially, we couldn't really have done the quality work we've done without the additional reimbursement that we're getting from the pilot. It does take some resources to accomplish all that work and provide extra staff, but we really think it's worth it to the patients, and we think it adds value to the system, and we're hopeful that overall the system will realize cost savings because we're taking better care of people, and we believe that.
The healthcare system is too complicated right now to be able to think one person is going to be able to manage that, and the patient needs all the help. And I think one of the things about a medical home is that idea of team behavior.
My name is Alicia Ailing, and I'm a patient navigator for Ammonoosuc Community Health Services. We work a lot with our patients and members of our community, and we help them to just overcome obstacles that they might have to obtaining appropriate medical care. There may be financial barriers, maybe transportation issues. They may not be able to afford their prescriptions.
The patient navigators can assist with all the other stresses that are going on in that patient's life and try to decrease them.
I think they helped out with the bills and the medications too, because they helped out with that. They do a tremendous job.
All of this is designed to maximize the amount of time that a clinician spends with a patient and not time doing all their other peripheral stuff.
At the beginning, I think it was a little strange for the patients here in New England to realize that there was going to be another staff member who were going to be involved in their care and know what was going on with them. But after they realized, oh, if my doc's not there, I can still call and get my question answered or still get a refill for my prescription, that angst has gone away a lot, and they feel pretty comfortable addressing their questions with various team members in the practice now.
We've broken this office down into 2 teams, and this allows us to divide up the work roles a little bit more efficiently, and also to have less confusion, because it's more likely the individual responding to the question or speaking to the patient will know that patient. And so I now, for most visits, have an assistant in the room who can help with the data entry.
The whole idea of having a provider extender in the room was they were able to tie out the whole visit. So the nurse was in there and the patient got the education immediately, and there was no question about what education she needed, and the patient was just like, this was the best visit I ever had. And that's what you want to hear.
I think the way we've enhanced access, what we've done is to allow the patient to be able to make appointments that are convenient for them. When they know they have transportation, they can be here. We work very hard to judge the length of time they need to be seen so that they have that adequate time.
Even the simple thing about not waiting in the waiting room forever. Lamprey really tracks that and tries to keep the waits as short as possible. But by the same token, I know that when I'm in with the doctor, he's going to take the time that's necessary to see me.
Well, the first thing that we need is to have everybody on the team who's interacting with the patient on the same page as we are and involved in the process.
And they've been doing that through their electronic medical record for a number of years.
Data technology is advanced in a way that we can save that data, find that data, and represent that data accurately, and use that to then take all the complicated data that's generated at this office and other offices and bring that data all together in a meaningful way.
If one of our patients presents at the emergency department, The emergency department has access to that record so that if the person's not a good historian or they're not conscious, then the ED can look at what are the medications, what are the allergies, what's the problem list, what happened at the last visit that I need to be aware of. So we're starting to see the foreshadowing of a health information exchange.
I've been able to see that when you inform someone about the condition, the steps they have to go through, the outcomes, the procedures, they make better decisions. They feel better about their decisions, and ultimately the satisfaction with their decisions and their functionality is improved.
The practice itself really has always been very interested in the preventative piece of their care.
It's about encouraging patients to take part in their role of their health care.
Each time a diabetic patient comes in, we give them a report card that shows their average blood sugars, their A1Cs, their blood pressures, their cholesterol, and we can use that to work with them on setting their own goals and where to go from there. So it's in the medical record in a way that's facile enough to pull out quickly, to summarize, and to focus, drill down on what the patient wants to work on.
When I was diagnosed with diabetes, I got referred immediately to the nutritionist and to the certified diabetes educator. Within a couple of weeks, I had enough information to go ahead and eat properly, exercise properly, and my disease has not progressed at all in 11 years. And my A1C at the last time was 5.6, which is 4 to 6 is normal. So, you know, for somebody with diabetes for 11 years, that's pretty good.
So success is going to be excellent data on our patient outcomes, which is produced by physicians and nurse practitioners who like what they're doing and aren't overwhelmed by the paperwork, and are working well with RNs, MAs, team coordinators who like their jobs and feel invested.
I think the first measurement is asking the patients if they've noticed a difference. What is their patient satisfaction? What is their patient satisfaction in access? What is their satisfaction in comfort? What is their satisfaction in feeling they're getting quality care?
And the success will come out of individuals who go and get health care and find that they are remembered and that they are cared for.
Success of this is really about the process, and it's about building the process of how we can collaborate with patients, how we can collaborate with providers.
If we look at the system in total, the whole population, it certainly behooves us to do better preventive care, manage chronic diseases better, and that does save money to the system. So overall, in the longer term, everyone wins.
Simply put, how we all win is healthcare costs going down and quality of care going up.